To a new global health alert. The World Health Organization has declared Mpox, formerly known as monkeypox, a public health emergency. Ariel Resif is here with the details for us. Good morning, Ariel.
Good morning to you, Michael. Global health officials are warning about the surging cases of a more severe strain of Mpox in Africa. The WHO hoping countries will now work together to help stem the tide of the virus spreading on the continent, mostly now among children. This morning, the World Health Organization declaring Mpox, the virus formerly known as monkeypox, a public health emergency of international concern as cases of a dangerous new strain spread across parts of Africa. The version of Mpox now circulating in more than a dozen countries on the continent, far more severe than what the U.S. saw in 2022. Back then, the majority of people infected were gay and bisexual men. But according to the World Health Organization, those most at risk today are under 15. They account for over 70% of cases and 85% of deaths. Fatalities worldwide topping 530, while the total number of cases is up an alarming 160% compared to last year. The strain in Africa hasn't been seen outside of that continent, and health officials here in the U.S. stress there is no elevated risk in this country. Cases of the disease here remain far lower than 2 years ago. Mpox typically spreads with close skin-to-skin contact. It presents with symptoms like a blister-like rash, fever, muscle aches, and fatigue. But the WHO says they're examining different modes of transmission.
Unsurprisingly, viruses will continue to evolve. We saw this with COVID, and now with Mpox, we see new versions of the virus that become more transmissible or potentially more fatal.
And again, health officials here are making it clear that there is no additional threat in the United States. But if you think you may be at risk, talk to your doctor and consider getting the 2-dose vaccine. If you've already done so, there's no recommendation for a booster at this time. Guys.
Good to keep in mind. Ariel, thank you.